What's the latest? How many doses? It's got to be 75 degrees below zero. Is it going to be elbowing? Is it going to be like, free soup? What do you anticipate?
So it's going to come in waves, and the first round that we'll get will go primarily to healthcare workers, but not all healthcare workers, those that are working directly with COVID-19 patients, and then EMS providers. And then as we get more vaccine into the state, priority groups are being developed. Those priority groups aren't totally determined yet, so you hear these rumors of what they might be, but they're not totally written in stone yet. Probably nursing homes and congregate settings like that would be the next one.
Pardon me, you're with the office. You are the regional director of the Office of Public Health. Are you out of the loop? What do you know? What do you hear?
Oh no. No, we're not out of the loop. Everything's kept rolling really quickly, but there are a lot of questions back and forth with the feds. The feds have their ideas of what priority groups should be. The states have their ideas of what priority groups should be. We put up our plan. It was well received to the federal level. So we have an idea of how we plan on doing it, but there may be little tweaks here and there.
Where will these vaccines be given out? Is it going to be at community sites? Is it going to be at the clinics? Will it be at your personal doctor? What's the plan for the first wave?
So for the first wave, EMS providers will vaccinate themselves. So the EMS group will get it, and they will have it provided to their staff. Hospitals will do the same. And then as we move into more of a general public, it's going to be provided from providers who want to offer it. So you have to sign up to be a provider, a vaccine provider. Our health units will be vaccine providers, but there will be pharmacies that have already agreed, Walgreens, CVS, that will be providers. So there'll be many options of places to get it. And you have to understand, right now it's kind of coming in trickles, but it's going to eventually come in a large number, because once all of their emergency use authorizations are through, then they're going to really step up production, and you'll have the numbers of vaccines that we need.
We're looking at the latest poll numbers that show about 50% of Americans say they want to get the vaccine. The other half, the number maybe 40, 45 or whatever, say, nah, they don't think it's been tested. What is your message to those people who are skeptical about this vaccine?
So, they just have to realize that this vaccine has been in development for several years. It started off when we first had SARS and then MERS. They're very similar viruses. So they started with a basic production of a vaccine and then, put it away as SARS and MERS went away because it was not a big issue, didn't spread the way we thought it would. Once COVID-19 came in, they had a basis for a COVID vaccine. They developed on that. There's been a lot of people who have already received this vaccine in testing, and then you're going to have a lot of people vaccinated in front of you or around you so that you should be able to see that it's safe, and hopefully that will allay their fears. We need, roughly 75 to 80% of us to get vaccinated to really see this go away the way we want it to. And then we're going to have to, of course, watch how long we have immunity from it, right? So that's the other side of the coin.
How long does the vaccine last once you get it? How long are you safe?
That's what we don't know. So they're going to keep watching whether you'll need it every year like the flu, or whether you'll need like a booster like you do with tetanus. That's something we're going to have to watch as we have years, under our belt.
I don't know if this is a question in your wheelhouse or not. U.S. government paid for this, but Europe gets it first. How'd that work out?
So I don't know exactly all the details behind that. I really am not a good person to answer that
I didn't know. I promise I wasn't trying to put you on the spot. I saw that last night. Some friends and I were talking about it, and I thought, well, wait a second. We kind of floated the boat on this, and I know that, and you can speak to this, I guess, that their regulatory system perhaps moves a little more quickly than ours. I don't know. I just saw that and wondered if you knew why.
Well, the FDA is very strict about vaccines. We have back in other flu years, pushed through vaccines that had, this is decades ago, but we did this where we pushed through a vaccine and it did have side effects. And so they don't ever want to do that again. And so even as we had a lot of push from a lot of different people around the country to get this vaccine approved, they really have drawn the line and said we're not doing it till we have the adequate number of studies and people through the studies. So that may be part of the answer right there, Robert, but I don't know if it's the total answer.
Martha, people who've already had COVID, at what point do they need to go get the vaccine?
If it were me, like you two that have already recovered, y'all have relatively mild cases, I would get vaccinated
right away.
Because
somebody had told me, somebody told me that the number of antibodies that your body creates is inversely proportional to the severity of your symptoms, i.e. I had a very minor case, hence I don't have many antibodies. I have a friend who had a really serious case, and so he'll have more antibodies. Is that true?
Well, it is true. The more your body has to fight the disease, the more severe the case for you, the more you're going to make the antibodies to fight the virus. So, yes, like for example, my husband has really high levels of antibodies still, several months later. Some people who have a mild or asymptomatic case may have no antibodies. Now, they still probably have some memory cells, which will kick in and make antibodies if you get exposed again. So it's not like you're totally have no immunity to it, but you don't have that strong response that you would want.
Okay.
So if you had a mild case, I would, yes, definitely consider getting vaccinated.
Okay, the question everyone wants to know. When will it be available to the general public?
I would think in early part of next year. So I think we're going to get, it really depends on those priority groups, if any of those change. But I'm thinking, in the first part of the spring, late winter, so February, March.
Okay, so we won't have to wait till May. Some people have been saying maybe not until May.
No, I think we're not going to see vaccine for children till May or June, maybe even later, because they haven't, of course, we delay testing in children until we've tested X number of adults, and then they slowly drop the age. So right now, Pfizer, for example, just dropped down to 12. So they have had only adults, then they went to 16, now they're down to 12 in their trials. Mm-hmm. So it's going to be a while before we have a vaccine for children. Gotcha. That will help us with our schools. But as far as most of us and the adults in the general public, we should have that, I would think.